When we're feeling anxious, what happens in our body is that our limbic system, which sits deep within our brain, is activated. And this is a survival mechanism within the brain in order to react to perceived threat. And it might be a perceived threat or it may be an actual threat. So what we see throughout the body is a rise of tension throughout muscles, our breathing becomes more shallow, and our heart rate increases as well. All of these are about the body anticipating to move and get us out of danger. The other part of anxiety is that there are three main responses, and they are to fight, so become agitated or annoyed, and that's where we often see a rise of anger when we're anxious, or to flee, so to avoid whatever we're encountering that's anxiety provoking, or to freeze, where we become rooted to our position and cannot move. So this is where we experience all of these symptoms when we're feeling anxious. In terms of deciding whether to seek professional help, it's thinking about the persistence of the symptoms. So as we know, with stress, it may ebb and flow and affect us day to day. But with anxiety, it's very persistent, and you'll have heightened experiences of stress and anxiety. And thinking about the physiological symptoms of muscle tension, worry, and breathing, feeling very fast, and also heart rate. So sometimes people feel that they're struggling and maybe worried about their heart as well when they're feeling very stressed and anxious. And you're feeling that life is really difficult to cope with. And it's persisting over a period of time, over at least 2 weeks. And you're feeling it's happening more than not. It's also having an impact on your enjoyment of life. You're finding that you're feeling distressed by these symptoms. And also, if you're finding that it's impacting on your daily function, so it might be stopping you from going into work or working in the way that you'd like to work, or avoiding social situations that you'd like to engage in with friends. So when it's impacting both on persisting symptoms, impacting on your pleasure and enjoyment of life, and when it's impacting on your functioning, that's when I would say that you need to seek further advice and support.